Okay, I've been a bit of a bitch baby. Went on vacation for the 4th this weekend, carrying the girls on my shoulders, carrying multiple bags. All of a sudden, my low back just locks down. I've never had like debilitating severe low back pain in my life. Like, thank God. I mean, it's 41 years of age. Without that, I've had little like tweaks and stuff, but nothing like this. So, yeah, for the past few days, I mean, it's anybody that's had it like it's a disease, but dealt with it, realizes like what I have is not disc based. It's just kind of some excessive muscle tension like that. Big trigger point and like some deep erectors that is just like running haywire. Did it to myself though. So in this video, I want to cover, how I think I got here, what I've been doing to overcome it, and doing some things that maybe most people don't do organically, or they're maybe even coached not to do. So the first things I started to do when it was kind of starting to aggravate me, when we were still on vacation, we're still lugging kids around and stuff, was like posturally, like the positions that I could get into that would help it. Hip mobilizations, 90-90 positions, flexing my lumbar spine as much as I could. And everybody that's like on the Kinzoid's like, oh, I'm sure it's still disc, you should be extending it. Like, I promise you it's not. But how did I do this to myself? So the precursor was I hit probably, and I'm not exaggerating, I probably hit 300 golf shots, maybe more than that, in our simulator 2 days before we left. Then I had my wife work on me a little bit because my back was sore. And then we had a long car ride. So it was just like a precipitating effect. I'm not going to say my age has anything to do with it. And, there I was, having to set the kids down and not being able to walk, having to sit down just randomly to get rid of back pain on vacation. And by the time we got back, I mean, it was to the point like I'm having to, lay down. I can't bend over and pick things up. When I do, I get these random, slips of pain. Last night I went out to push my daughter on a swing and I slipped on a little rock or something, and it's just jolting lightning bolts of pain, and then a low level to high level tension all day long and at night. So nothing that, millions and millions of people deal with, each and every day. So in a lot of ways, it's actually helped me to understand what people are dealing with, since I've never dealt with it. And I maybe I'm a glutton for punishment, but I always tell my patients I feel like I've dealt with every injury that you could see. Now I think I probably have, because this is probably one of the last ones on the list. And it helps me empathize with my patients. It also helps me talk from experience of, hey, I've been there, and we can't do some of the things that are talked about. Like, we know that rest, in particular for low back things, is not advantageous. That's why I am out here today. I would like to be running. And if I'm being honest, I haven't been able to run I've been able to run, but my knee has been bothering me for a while. And God, it does sound like I'm getting old. Just from who knows what, random, just kind of tweak that's been a little persistent, and have worked on it. But am I out here pain-free? Not by a long shot. Like, if I take a misstep, catch my toe on a root, I am in 8 to 9 out of 10 out of pain. Walking around, it's like 1 or 2, but I'm moving, and I'm going to keep moving. That is important for a variety of reasons. Low-level aerobic work like this, if I could get on a bike, I can go for a hike. If I can still run, if I can, do some low-level, body weight stuff. That aerobic input is highly anti-inflammatory. It's also just palliative from a movement standpoint of offsetting pain if the movements you're doing aren't, exacerbating the issue too much. Now, I guess I should back up here and give a precursor or cautionary statement that, we really lean on the diagnostic process in our clinic in terms of, we want to be accurate, we want to be specific. That allows us to point any intervention that we decide to use more appropriately, which makes treatment more efficient and effective. That being said, I'm a practitioner now, self-treating. We also have other doctors that have treated me. We'll talk about that. But now knowing, okay, I'm not dealing with the disc issue. I'm not dealing with, some sort of like spar or pars injury. Yeah, I'm dealing with like a gnarly, oh my God, I'm going to say it, trigger point that is wreaking havoc. Can dissipate symptoms. They'll return fairly quick. And now I'm, maybe 5 days out from the initial onset. But what I didn't do was just rest, take time off, stop moving through painful movements, but I had to know what I was dealing with. So if you're out there and you're worried that you have a disc issue, you have a stress fracture, get it checked out, right? That's why people like me exist. That's why we have jobs, not necessarily to get you to come in 60 visits and pay my mortgage. It would more so be to what? To ensure that you're not doing something that is going to further injure you, damage something, keep you in the pain cave. We're trying to get you out faster than your physiology would on your own. That being said, once you know it's not, the things you're going to do aren't going to injure you anymore, or you know that basically there wasn't an injury to begin with, it was just a pain mechanism or something that got wound up, which is what I think mine was. Now you got to be a little bit aggressive. And like I saw a girl yesterday that I've seen in the past for low back pain. Well, lo and behold, 2 weeks ago, she had an acute ankle sprain. Didn't come and see me because she went to the ortho, got an x-ray, which is fine, get it checked out. Then was doing, PT via her, school system. And what is she doing? She's 2 weeks out and she's not playing. She's not moving around on it. She can't single leg hop on it. It's still bruised and swollen. Ankle sprains are one of the easiest things to treat, in my opinion. We have to be aware that there are risks of, full ruptures of ligaments. We could talk about that in a different conversation. Fractures, Jones fractures, fibular fractures, chip fractures of the navicular. Like all these things could be possible. Proper diagnosis. Once the diagnosis has been made, we determine, I have a grade 1+, 2 ATFL sprain. Cool. Let's get aggressive. Let's get this thing moving. Low back, not that different. We think it's different because the pain mechanism is so, no pun intended, so central to everything we do. So an ankle, I can limp, right? A low back, we become antalgic. For me, flexing forward to a certain degree feels better. Trying to get fully upright is not my favorite thing. But also realizing that any movement I do, I don't know when the pain is going to strike. And that's what becomes gnawing and weighs on me. And if I'm being honest, it has made it hard for me to think when I'm with patients. It's, I just feel cognitively like I'm distracted. So again, it allows me to empathize when people tell me it's just kind of ruling my life. I get it. And I'm, not nearly as bad as a lot of people I've seen and a lot of people that are out there dealing with this. So all that to be said, if you're dealing with low back pain, and you're not having severe radiating symptoms down your leg, let's see how I do going under the slog here. Better than I was yesterday. Should I say better than before? So if you're not having massive radiating symptoms, you're not having strength issues, you're not having what we call motor weakness, you're not able to lift your foot, you're not able to push off, you're not having massive numbness and tingling. And I'm saying, if you notice, I'm saying massive, a lot, because you might have minor things like that and you could still have a minor disc issue, a minor nerve irritation, a pathoneurodynamic scenario. All these things could exist, a trigger point that's referring pain and creating paresthesia. All these things could persist, and it doesn't mean that you have something that is so far damaged that we need to pause and rest, because it just drives me nuts, right? We get a simple stress reaction in somebody's lumbar spine, golf or volleyball player or whatever, 6 weeks rest. Yeah, we might rest from their sport, we might rest from certain activities, but that doesn't mean we're going to just rest. We need to be active. We need to keep things moving. We may need to improve how things move. That's what I've really tried to do over the course of the last 5 days, is be honest with myself and say, what have you neglected that probably led to not only your back getting jacked up like this from just carrying your kids and luggage around? Why's your knee been bugging you when you go run? There's deer out here in front of me, hopping along. I bet it doesn't have back pain. And I have a titanium rod in my left femur. I've had that for 31 years now. My right side and my left side move different. I need to work on those differently and more. I can work on ankle mobility and function, and I could, like most people, work on some mid-back extension, rotation, mobility and control. So all that to be said, I've dove into that. I've dove into actual treatment. So I just had one of our docs, shout out to Alex, dry needle my back, which gave immediate relief. It didn't last that long, right? That's kind of common, right? That only passive treatments are passive, palliative, but also usually short-lived. Why? Because we need the input. We need to override the system because the system's trying to help you, and sometimes the help hurts. So like that little trip kills my back. We were demoing a cold laser. So I've been doing class 4 laser. A lot of different movements. Some movements aimed at pain relief specifically. Cupping. I mean, manual therapy for my wife. Like all these things we've done. Nothing's been a home run, if I'm being honest. You know what's been a home run? Moving. And that's where, you know, as I started this video out, I've been a bit of a bitch baby because I kind of was just like, I don't know if I should go do that. And I got fed up, and that's where I was like, I'm going to go hike. I might try to run. I tried to run for about 10 yards, and it felt like a K-bar knife was going in my lumbosacral junction. So am I out here just, you know, crushing a 7:30 mile on the trail? No, I wish I was. Also, after this, I'm going to go try to swim. I don't know if that's going to be good or bad, but I'm going to try. I'm going to keep kind of, as we would say, poking the bear until I get proven otherwise that thing made me worse. And we say it in our office all the time. Sports medicine is largely, we're getting progress one of two ways, and maybe a standout third. The one of two ways is either we have the same amount of pain with more stuff, which is progress, especially if you have an athlete that is wanting to compete, or you have less pain with the same amount of stuff. We're never taking away stuff and hoping that we have less pain. I mean, that just makes sense. It's going to happen. Sometimes you have to rest people when you have a legitimate injury. The win-win would be what? We do more stuff and we have less pain. And believe it or not, that's actually usually what tends to happen once we went through the correct channels, diagnostic process. We've ruled out what we call black hats, or those things we don't want to see happen, and then we're good to go. So I'm out here challenging myself. I'm hoping that I feel better tonight than I did last night. I'm hoping I feel a little bit better tomorrow than I did today. And I'm also okay with, if I piss it off a little bit, that I did it to myself. I take ownership. I'm being safe. I'm not being stupid. You know, we have athletes that we try to pull the reins back and they don't want to do it. And, you know, then they're responsible for their own undoing as well. But as long as we're at the center of their care right along with them, and we, you know, let them know what we think is going on and what's good, bad, or otherwise, you know, then they can make their decision as long as they're an adult and, you know, they're aware. So I'm out here, like I said, every once in a while getting stabbed in the back with pain, but still doing it. Gonna go for a swim, see how it feels. I don't know when I'm gonna play golf. And if I'm being honest, the fancy term in our office would be fear avoidant behavior. I'm like, Jesus, I don't know when I want to swing a golf club next, but I can guarantee you one thing. You know, you get yourself into the injury or in a few different ways. One of the more common is going from 0 to 100 in anything, right? Couch to 5K, 5K to marathon, 5K to ultra marathon, not working out at all to CrossFit classes, not hitting a ton of golf balls and putting a simulator in your office and hitting 300 shots on a Wednesday. So I am my own undoing, and I can glue myself back together, and maybe there's nothing to glue back together. I just kind of have to basically pay attention to what my body's telling me and respond appropriately. So I hope this little, I don't know, maybe this is like is this vlog? I guess this is vlog entry at this point. And I know that I don't think the sound is going to be the best because I'm just using my cell phone. But whatever it is, I hope this helps somebody. If you have questions about why I did certain things, I'm not going to be super specific because that's actually the antithesis of this video, is the specifics. It wasn't the dry needling. It's not the soft tissue, what technique was used, exactly what diagnosis I think it is. It's the lack of specificity because I don't think I have an injury. Now we can be more general and have a general movement approach. And if you're in my field, our field, watching this, God, there's a tidal wave of that occurring first without diagnostic accuracy, ruling out injuries, that we have this general movement approach for actual injuries, which I think is a huge mistake, but it happens all the time. And there's a giant spider web up here that I'm going to try to avoid. This is my second limbo session of the day. So yeah, it can go both ways. But again, like I said, I hope this helps somebody. If you have questions, you can post them in the comments. If you've dealt with low back pain, LBP for, I don't want to say LBP for life. That sounds terrible. I do not want it for life. But yeah, I get you. I know where you're coming from now, and let me know how I can help. See ya.